Hello and welcome to today's webinar, where we're going to be exploring the condition systemic sclerosis and discussing how one might share this diagnosis with family and friends. This is a very rare and complex disease and is unknown. So levels of awareness make this kind of even more difficult. My name's Sue Farrington. I'm the president of FESCA, and my sister had systemic sclerosis. So the perspective that I will bring today will be as a family member. But I'm joined by three experts who will very briefly introduce themselves, and I'll start with Ilaria.
Hello, everyone. Thank you for attending this webinar. I am Ilaria Galetti. I live in Italy, and I've been coping with systemic sclerosis for 27 years. And in the meanwhile, I became vice president, Sue, of FESCA, the Federation of the European Systemic Sclerosis Organization. And I am very happy because I've been ePAG in ERN ReCONNET since the beginning, 2017.
Thank you. Vanessa.
Hello to all, my name is Vanessa Smith. I'm a rheumatologist. I'm working in the Ghent University Hospital and I'm treating people who are affected by systemic sclerosis since 2008. It's my honor to be co-disease coordinator of systemic sclerosis and European reference networks in rare connective tissue diseases, together with Marco Matucci and with my wonderful ePAG, Ilaria and Sue Farrington. And today I will tell you something about the disease from the physician perspective.
Thank you. And Marco.
Thank you, everybody, for being with us. My name is Marco Matucci. I'm a rheumatologist at the University of San Raffaele in Milano, Italy. It is a very great pleasure to be here today with such lovely ladies, with Sue and Ilaria, and also with my co-chair, that is Vanessa Smith, in the ERN, in the working group on Scleroderma. Thank you, Sue, please.
Thank you. So I think this is a really important webinar because when an individual receives a diagnosis, it's confusing. But then when the surrounding family and friends get to hear about that diagnosis, it's even more confusing. So we want to try and unpack how you might go about explaining to your family and friends, how you might engage with them or not, as the case may be. And so I think it's appropriate that the first person I come to is Ilaria, who's going to talk a little bit about how she first kind of started to detect that there might be something that wasn't quite right and explain to you what she experienced.
Thank you, Sue. I started with the first sign of systemic sclerosis, blue hands in summer, while studying at the university in a very warm moment of the year. And I'm very grateful to my grandmother because she said, oh no, we need to understand why your hands are becoming blue. So she referred me to a doctor that had the doubt of an autoimmune disease. And he referred me back to an expert center. And then I got the diagnosis in less than 3 months. So it was a preclinical phase. I'm very lucky. And this is what should happen to every patient. But nonetheless, when I went back home, there was no Dr. Google at the time. I'm not that young. And we had a medicine book, encyclopedia at home. Oh my gosh, it was really terrifying what I read. 5-year survival. So I was a girl that was just in the mood of changing the world, and I was despaired. So my family as well. Maybe because at the beginning, I didn't receive the diagnosis in an appropriate way. It was just systemic sclerosis. No, scleroderma. Go back home. So I was even more scared. What's going to happen to me? Am I going to die? What have I done to deserve this? Are there therapies?
I think that's a very familiar thing, Ilaria, isn't it, that we hear from our community, that people think, what have I done? what should I have done to prevent this? And I certainly know that from my sister's experience, the first thing that I noticed was exactly the same as you, where her hands changing color and being a very alarming white color, and then turning blue. And what then happened just within a few months was that she started to have those kind of sore, swollen, puffy fingers. But what she was also experiencing, but she didn't share with anybody, was that she had really bad acid reflux because she didn't know to put those symptoms together. And I think that's why the kind of education that's taking place, both with clinicians and with our community, about those kind of red flags is so important. But I'm very conscious that systemic sclerosis affects different people in different ways, and different people may present with different symptoms. So Marco, I wonder, from your perspective, you've heard the story of Ilaria and my sister, but how else do people kind of present with systemic sclerosis?
We have heard Ilaria remembering us that the Raynaud phenomenon is for sure one of the most important signs at the beginning of the disease. However, we should highlight the fact that we may have also other kind of small signs and symptoms. One of these is for sure the puffy fingers. So the swelling of the fingers and of the hands that sometimes is in parallel, it's appearing in parallel with Raynaud phenomenon, and maybe a very important sign, as our experience has shown in the last 10 years, also because these two elements, clinical factors like Raynaud phenomenon and puffy fingers, are now two pillars, clinical pillars for the very early diagnosis of systemic sclerosis, in particular when they are coupled with the hematological investigation that is usually searching for antibodies. And in parallel, it's very important to remind, and Vanessa Smith is with us today, about capillaroscopy. So these are important elements that are able immediately to give us the scenario and the very high suspicion of having the possibility to have in front of us a patient that has a very early systemic sclerosis.
And I think these are also really important for family and friends to know about. The more we can share this information, the more that those people around you can, you know, as Ilaria's grandmother did, very promptly said, something's not right here. You need to go and get that checked out. So Vanessa, I think obviously then if somebody does present to you, what are the tests? How can you kind of reassure family and friends that there's a kind of robust process in place to test for systemic sclerosis?
Thank you so much, Sue, for this nice question. So as Ilaria said, she had Raynaud's phenomenon. And what we do now, and we need to thank the European reference networks for that, is we made patient pathways. So we are creating patient pathways which should be deployed by each national authority. And this says that if you have Raynaud's phenomenon, you must immediately send your patient to a clinic where you execute capillaroscopy. Because capillaroscopy in combination with systemic sclerosis specific antibody can, in a case like Ilaria, immediately detect if she has a high chance to get the disease. Or as in your sister's case, you said she had Raynaud's phenomenon, some puffy fingers, acid reflux. Also, she should be sent by the patient pathways that are created by European reference networks to an expert center, because there they can clinically see if this lady has puffy fingers, and then we can explain to these people what type of investigations we do at a baseline visit.
So before we go on to kind of exploring how Ilaria and I kind of dealt with, well, rather how Ilaria dealt with telling her family and how I received the information from my sister, I think we were both really curious to understand that when you have a patient sitting in front of you and you have gone through the tests and you know that they have systemic sclerosis, how do you go about giving that news to the patient? Marco?
So usually, this was not before an easy task, because some years ago, let's say a decade ago, it was almost a sentence. We did not have drugs. However, today, I have to say that we have drugs. We have several possibilities, in particular if the diagnosis is very early. So usually I try to comfort the patient and to explain to the patient which kind of possibilities we have, in particular if we are in a very early phase. Just explaining how much we can interfere with the disease progression, because we have at our disposal drugs that can help us to slow down the disease in order to allow a very high quality of life of the patient, trying to avoid what we call the disease progression, because the disease progression is today a big problem for us, and that's the reason why we are so much focused on this item and explaining this item to the patient. The patient may follow also our effort in order to provide the best treatment, reminding the patient that the compliance as well as the follow-up are very important in order to really have the best out of the treatment that we shall choose together.
And I think that word together is also really important. The whole world has moved on, recognizing that communication and shared decision making is so important. Vanessa, is there anything that you'd like to add? How do you approach giving what can be quite shocking news to someone?
Well, when we have the diagnosis and when we have to explain to the patient who's sitting in front of us what's going on, as you both said very nicely, it's a rare disease. So I start to, first of all, ask them what they would like to know about the disease. Everything. Some people want to know everything. Some people want to know nothing. That's the first step I take. If they say they want to know everything, then I go through step by step what organs might be affected. And I do that together with them. I say it's a disease which affects vasculature, but also a disease which affects connective tissue disease. And I go with them through what might be the symptoms. For example, I say you have extra connective tissue disease. If that occurs around the lung, what do you expect happens? So then I explain what symptoms they might get. Also, if, for example, you have extra connective tissue disease on the esophagus, what might happen? They might get dysphagia. And I take that so they can step by step understand what organ might be involved, and I can lead them to the next step and inform them that now a new life will start for them. More specifically, that they will see me more often. More often to screen all organs, and linking to what Marco says, that we screen organs because we now might have new therapies. So first I explain to them the components of the disease. I go through them about each organ and interact with them so they can know what the symptoms are. And then when I'm done explaining that from my point of view, I ask them to now tell to me what they will tell to their husband or to their family or to their friends. If they can explain to me what I interactively explain to them, then I know they understood. If they cannot, I repeat and go through everything. So the moment to give the diagnosis is a very crucial moment where you need to take the time and sit together, because otherwise it might be too overwhelming. Also, even when they know what I've said, I ask them to go home, and if there's any question they have, to phone me back after the weekend. This is mostly how I deliver the diagnosis and how I deliver the link to the next step, which will be regular screening and regularly coming back to the expert center.
Thank you. And that listening, I think, is really important to understand just how much information somebody can take in, because as you rightly say, they may appear to have taken it in, but they'll get back home. And I know for me being treated with another condition, I completely forget everything. So then when it comes to actually sharing that information with your family, Ilaria, how did you approach that?
Well, keep in mind, I was younger. What I would recommend is to select the persons you want to share this information with. It's something very personal and also precious. So share with the people that really want to know how you are. And it's absolutely important to share it with the family members, and maybe the partner or the mother will be in the office when the patient receives the diagnosis. They will be together. And it's important because they will be able also to understand something which is not visible, our fatigue, our mental health status. They will be there to help and really understand and maybe raise questions for the doctors. As Vanessa said, also caregivers are allowed to have questions, and they will share the new life with the patient, supporting the patient. And also, but maybe you will explain better than me, it's easier to be a patient rather than being a caregiver, because I know what is happening to me, and I will not share the information with my employees or employers, because I know that some patients had problems with their work. Some of them have been fired because they had to take working days off for therapies. So really consider the people you want to share this information with carefully. You don't have to do it because you have to do it. And share it also with a psychologist that can really support you in digest this very important moment.
I think that's a really important point, Ilaria, but unfortunately, far too few people have got access to those services. And I think it's a point that we should continue to underline the benefit of being able to talk to somebody who's not your clinician and who's outside your family and friends. So I think that's a really important point to share to people, to see if you can access those kind of therapies. Ilaria, how did you explain to people that you wanted to share the information with what it was that you actually had?
I was honest, saying what I knew about the disease, which is different than what I know now about the disease. And I didn't want to be treated as a sick person, but a person that could do things in her own personal way and time. So I didn't want, and I don't want to be considered sick. That's important to me, and to give the disease its space and not to take advantage of my life. And being treated like a, let's say, normal person, it's really helpful also for the others, then that don't have to watch over you minute after minute. I didn't always succeed in it, thinking about my husband. So Sue, on this topic, can you share your experience being on the other side, living with your sister, your loved sister, that was affected with systemic sclerosis?
So it's interesting because everybody responds to being diagnosed very differently. And my sister, like yourself, had actually quite a quick diagnosis from those signs in her early 30s of Raynaud's. Within 6 months, she had the diagnosis. She also had lung involvement. But we knew that something was wrong, and we knew that she'd gone to see a rheumatologist. But then it took her a while to share with us what was actually going on, because my sister was somebody who wanted to go and do her own research, which I have to say back then she really lived to regret, because she did go to Dr. Google, and it terrified the life out of her, a bit like you. And then our role as the kind of family members was to kind of come around her and to try and also do our research to kind of bring hope, because the information she accessed was bleak, and not the reality now for many people living with systemic sclerosis. As Marco was saying, every year there are more clinical trials taking place. And I think for me, that's why my plea to clinicians, and both Marco and Vanessa, you too are doing this, it's to signpost patients to trusted patient organizations where people can access information and support in their own time. Many patient organizations produce really credible, evidence-based information. And as long as the individual knows that that support exists, they can kind of go to it, rather than leaving somebody to do that kind of Googling by themselves. I think the situation has changed enormously, and having organizations like ERN ReCONNET make sure that there is quality information out there. But I think, yes, as a family member, we saw our role to try and help her put things in perspective and to provide that element of hope. So we often hear from members of our community that people say, oh, you look well, you look fine. And I agree, people don't want to be defined by their condition, but that's often not the reality of living with something like systemic sclerosis. So Ilaria, what have you found to be the impact that it has on your life, and kind of how do you go about dealing with that?
Not easy, not easy. The impact is really high. I have a very full agenda for next 2 months, just doctors, tests, exams, and so on. But that's my life. I couldn't imagine my life without systemic sclerosis. Okay. Of course, I had to leave my job. I can't go daily to the office, so I brought the office into my living room. Of course, breathing is not easy. Getting oxygen is not easy, but I didn't stop moving. I found a way to get oxygen abroad. And what I would like to say, living with such a complex disease is not easy. It's not easy, but we become stronger when we have to, let's say, fight. Is not a term I like because I don't have an enemy, but we have to react in the best way. And as you said, refer to a patient organization. They can really help you. They can put you in contact with people that got it. They went through it, and they, let's say, using this terminology, they won and they made it. It's not easy also for my husband. But, you know, we shared the journey together, and I've been very lucky having him that decided to change his life accordingly. But yes, it's really burdensome. It's like a tornado, but we have a bunker where we can be safe and go out the next day.
And I think one of the things that we hear is it's really important that people have somebody to share some of the challenges with. But I certainly know from my sister's perspective, she hid the reality from her friends. and she never told her work colleagues that she had systemic sclerosis. So that when she did pass away, her colleagues were absolutely shocked, because a bit like yourself, Ilaria, she did not want to be defined by the condition, and she really enjoyed her job as a lawyer. Interestingly, when I met some of her colleagues, they all said, gosh, we thought, how does Nikki stay so young looking? We all thought she'd had Botox. But that was another thing, actually, that I noticed over the years with her, because it does sometimes, for some people, have an impact on the way you look. And she would perhaps increasingly become very self-conscious about that and withdrew. So I particularly saw in the later years her withdrawing. And as much as I tried to encourage her to go and talk to other people like herself, that wasn't something she did. She took her refuge in doing research and really trying to better understand the condition, so that when she did finally get the diagnosis of pulmonary arterial hypertension, she probably already knew she had it, and she already knew what the treatment options were. So I think the key thing here is everybody responds to a diagnosis in a different way. Everybody deals with it and reaches out for different sorts of support. But again, I keep coming back to the fact that there are organizations out there that can work alongside clinicians so that we provide that more kind of holistic support for patients. I think when we think about young doctors coming up, hopefully their training is very different. And I think probably to sort of wrap up before we answer some of the questions, it would be good to kind of get some key takeaways from all of us. But I want to come first to Marco and Vanessa to ask you, what would be some of the key things that you would say to kind of young clinicians coming through about the way you communicate and the way you support your patients?
Please, Vanessa.
Well, first of all, I would say to the youngsters, adapt your tone when you're speaking to someone giving this diagnosis. Be there for your patient. Ask them if they have questions for you, and tell them that you're there if they have future questions. In fact, inform them that you will start a new life together and that you will have a long pathway to go together. But as both of you very nicely pointed out, that there's also something besides the physician, that there are peers, that there are trusted patient organizations and also psychologists who are there to help the person who just got the diagnosis. That's my message to the youngsters.
Thank you, Marco.
Usually, what we try, first of all, we let them listen to us when we speak with the patient first. And so just to understand which is the line of relationship that we try to create with the patient. And one of the very important points that I try to transmit to the young colleagues is that you must get to the point to have the help of the patient. So an important point that I remember always, that you must gain the trust of the patient, because he needs to help you, not only you to help the patient. But one point is that I tell always to patient is, I need your help, please. Let me help you. But to do so, I need desperately your help in order to understand as soon as possible what is going wrong, if there is something that is not working. So please do not hesitate to contact me as soon as possible. So these words, help and relationship with the patient, are so important for our younger colleagues to understand, because this makes easier our profession. It's making us capable of understanding in real time what are the problems and how to cope with these problems in the best way. Sometimes the problems are not only technical from the medical point of view, but they're also human. because sometimes few words are enough, and they are more important than a receipt or some long discussion, but few words are important just to put the patient calm and serene and following you in a long path, because it is a long path. We have to remind this to all of us. This is not a 15 minutes job. This is a job that will last for years. And that's the reason why the patient must understand that you will follow him, that you will be with him in this struggle against the disease. So it's not easy. It's not easy. And sometimes we have to admit, as doctors, sometimes we are tired, sometimes we are pressed by many things, and we are too fast. We are too fast. So this is something I try to make our young colleagues to understand, that you should not be in a hurry when you see a scleroderma patient.
And I think that's really encouraging for patients to hear as well, because what you've done is say this is best practice and almost set the kind of standard for what people could and should expect. Ilaria, what words would you like to say to kind of the upcoming young clinicians?
Put yourself in the shoes of the person which is sitting in front of you. And imagine that you could be the one receiving such a terrible diagnosis. How would you like a doctor to give you the information? So try really to make this game, and maybe think that this person will not be able to do the things she's doing now. And if I tell you, you will not be able to become a doctor because you can't work in the evenings, in the nights, and you have to forget all your dreams, your career. That could be what I would like to deliver to this. Let me say, I know many of the youngest amazing guys.
Yeah, and I think it's really important to not underestimate the importance of those kind of interpersonal skills, that kind of humanity. That is so important, because I think, as everybody said, this is about a partnership, and it's about looking at the lived experience, because those with the condition understand their bodies alongside those with the learned experience, and coming together. That really is the way, I think, to make sure that that shared decision making and that clear pathway moves forward. So thank you, everybody, for those contributions. I hope whoever's been listening, that's been helpful. But I think there may be a few questions, Vanessa.
Yes, it's my pleasure to read the questions to you. And first of all, several people congratulate you for explaining this so perfectly. So thank you to all. Somebody asks if only my GP would understand this condition. May I ask to the three of you how the GPs can be more informed about this disease and about communication between people affected by the disease, their family, and physicians?
May I start?
Do, please.
Of course you may.
We are very lucky because we have a sign, which is a Raynaud. And so this is something not natural. And I don't assume that a doctor, even the best one, knows the symptoms of 7,000 rare diseases. But Raynaud should raise the doubt and send the patient to make some further tests to an expert center. That's it for me.
So
Thank you,
I think
Darius.
in quite often in some countries, the GP is one of the kind of primary interfaces. And although they receive secondary care, sometimes they have to go and see their GP. And the GPs don't necessarily have that level of understanding. I think one of the things that we can really look at is maybe the creation and the development of specialized networks, so that not just secondary care physicians, those general rheumatologists, can tap into the specialist centres, but also GPs, if they are really there frontline supporting their patient with systemic sclerosis, they too should be able to access that specialized network and seek information, because as you rightly said, Vanessa, you know, this is a rare disease. There are 7,000 odd rare diseases, and many GPs will only come across systemic sclerosis once in their career. So we've really got to do more to make sure that GPs are supported to best support their patients, I think.
Thank you. Marco?
Yeah, I think that, I mean, this is one of the most important point, in particular for what you said just now, the support to the patient. So I think this is, it seems so simple. It seems so simple, but in reality, it's difficult because it is a multifaceted problematic that we have. To be helpful to the patient from different point of view. So first of all, you must be a doctor, you must know the disease, you must have experience, you must, so there are a lot of medical must. But at the same time, you must also to understand the psychology of the patient and to understand, because the patients are all different. They come from different backgrounds, they come from different educations. Health literacy is profoundly different sometimes. So we must be ready to face also the problem of health literacy in front of our patient. And we must be able to have always a really human approach that could allow us to face any kind of patient. And this is very difficult, I have to tell you. Sometimes it's very difficult. Sometimes the patient is very emotional, and this becomes touchy and you lose the focus sometimes. Sometimes the patient is very distant and he is not sympathetic toward you for many reasons, for different kinds of reasons, but you would never have to give up. So this is the important message. You have never to give up, because whatever is happening in front of your eyes, you must always be able to understand what is going on from the patient and disease point of view, and also from the psychology of the patient. And sometimes I have to add also, not only the psychology of the patient, but of the family, which is coming with the patient. That is the third point that we did not address this afternoon. We should not forget, sometimes mother, father, aunt, they're even all together, the whole family. So you have to face the whole family. And sometimes this becomes very problematic, you know, because you have to explain carefully. You have to choose the right words, because everyone thinks in different way, and you have to homogenize your behavior in order to give really and to be able really to help the patient, even if the family is there. And you know how it is. They come and they say, maybe we shall get another opinion. And also in front of this, you must be open. Never close the door to a patient that wants a second opinion from another one. So we should not forget this, because this is correct. And the patient must be free to choose. And so not an easy job at the end of the day.
This brings me to another more challenging comment, and I would like Ilaria and Sue to start first replying. But one of the comments in the chat is, I only wish my family and friends would understand they're not interested in such a debilitating condition I have had for 20 years. What would you reply to this colleague of yours?
So given that I'm coming from the family perspective, I think because nobody really understands this rare disease, and similarly for other rare rheumatic diseases, a colleague of ours who has systemic sclerosis has exactly the same experience with her family. They don't ask her how she is because they don't understand. Whereas she then recently was diagnosed with cancer, and she said their attitude changed completely. They kind of understood what cancer was, and therefore they were able to engage and ask her questions. They checked up on her all the time because they felt they understood what she was going through. So I think what we need to do is really continue to make sure that there is greater awareness of systemic sclerosis and all other rare connective tissue diseases, so that when somebody says, I've been diagnosed with a rare rheumatic condition, it's like, oh, okay, it means XYZ. And that level of understanding will help increase that engagement. The more materials that we can maybe produce specifically for family, then that might also help as well. But no, it is a real challenge. And I think it's that lack of understanding that prevents that kind of support and interaction.
And I think that you all, rheumatologists, should have a leaflet of your national patient organization to be given to the patient, because it's another way you can take care of them. So signposting your patients to the place where awareness is made, and leave the patient organization. Don't just expect to receive something from it, but as someone better than me, don't think what patient organization can do for you, but think of what you can do for the patient organization, and it's the patient community.
Thank you so much, Ilaria. And I must say to the audience that both Ilaria and Sue, who's a family member of, continuously live for the patient organizations and for the patients affected by this disease. I would like to read one quote to you all before we have to close the session, but somebody joined late wrote, "Although I joined really late, the presentation from each of the panel members really resonated with me as someone living with scleroderma and other autoimmune conditions for the past 9 years. Thank you for such an informative webinar, and it's refreshing to hear from people living with this condition. It makes me realize I'm not alone." So also from my side, Ilaria, Sue and Marco, thank you so much for this webinar that we executed today together.
Thank you very much to
Thank
everybody.
you to everybody, yes, for attending.
Thank you.
Really appreciate it being together.
Me too.
Thank you very much.
Thank you.
Bye-bye.
Bye.
Bye-bye.